Hey everyone, my name is Sarah and today I'll be talking to you about postpartum disorders. Postpartum disorders are extremely common. Approximately 80% of women will experience the baby blues, postpartum anxiety, postpartum depression, or postpartum psychosis after they give birth. However common they may be, society's expectations and pressures to enjoy every moment and this should be the happiest time in your life often cause moms not to want to reach out for help in fear of being viewed as a failed parent. I think this stigma needs to change, and the best way I know to do that is to educate more people on the subject matter. I myself have experienced baby blues and postpartum anxiety after giving birth to my son over 16 months ago. So I'm hoping that I will heed my own advice for the future. The most common of the disorders are the baby blues. 80% of women will experience this after they give birth. It can start after delivery and last up to a month. It's often the gateway for postpartum anxiety or postpartum depression if it's left untreated or you don't talk about it. Some of the symptoms include insomnia, not being able to sleep when the baby does, mood swings, loss of appetite, crying, feeling overwhelmed, or feeling inadequate as a mother. It's not only new moms that experience this, new fathers can as well. There's often stem from a history with depression, rocky relationship with a mom, or financial worries over how they're going to provide a stable life for their new family. All the disorders I talk about today stem from the same main causes, the main one being the hormonal shift that women experience. According to Dr. Elizabeth Feidelston, director of the women's program at Columbia University Department of Psychiatry, a woman's estrogen and progesterone levels increased 10 to 100-fold during pregnancy and will plummet to 0 within 24 hours after birth. This combined with extreme sleep deprivation, the pressures of being the perfect mom, the way that your body looks different, the way your relationship looks different, the way your financial situation looks different, being the sole responsibility provider for another human being. All of this combined, like I said, with sleep deprivation, there's no wonder why moms feel the way that they feel. Now, if this lasts more than a month, then chances are you have postpartum anxiety. Postpartum anxiety is rooted in worry, and it is one of the most common of the disorders. According to Dr. Sarah Hominsky, medical director for the Alexis Doyle-Kiel Center for Perinatal Health, doctors don't do a good enough job screening new mothers for anxiety, even though they see more cases of postpartum anxiety than they do postpartum depression with new moms. Postpartum anxiety, it causes you to have extreme worry, excessive worry, loss of balance and calm in your life. Every waking moment you have, you're thinking about the baby, if the baby's okay, baby's alive. It's often these moms that have postpartum anxiety that need the most help, need a break from the baby, need time to themselves. But due to the excessive worry, they will often turn down this offer because they believe that the baby will die if it's in anyone else's arms but their own, because the mom is the best person to take care of their baby and no one else can do as good enough job. I know this because I had postpartum anxiety and I lost my job because of it. I did not return to work after a measly 8 weeks after giving birth because I was still healing emotionally and physically. And I did not want to leave my baby with a complete stranger. I couldn't leave the house for more than 20 minutes without the dreadful thoughts of something happening to him entering my mind. Now, the most common, most talked about of the disorders is postpartum depression. 1 in 5 women will experience this. Whereas postpartum anxiety is rooted in worry, postpartum depression is a complete loss of heart. It hinders you from being able to do basic day-to-day activities, like bathing yourself, feeding yourself. It can cause an inability to bond with the baby, an ability to care for the baby. You just don't care. You don't want to do any of it. You have no interest in doing it. Whereas postpartum anxiety, all you think about is the baby. Postpartum depression, you don't want anything to do with the baby or yourself. You have thoughts of harming yourself for the baby, oftentimes and not when you are suffering from postpartum depression. Symptoms are the same. except for they're more intense depression, intense fatigue, intense mood swings. Now, postpartum depression is often when more people reach out to help because there is a trickle effect. If a mom is suffering from postpartum depression, oftentimes the father, the other parent of the child, will experience the depression themselves, and the child can often grow up with behavioral or emotional issues due to it. Now, the most severe of the disorders is postpartum psychosis. This is when 1 in 500 women will experience this, which is still way too many. This is when the thoughts of harming yourself or your baby turn into action. The most severe symptom for this are the hallucinations and the delusions. It's those scary stories you hear about moms drowning their children because they have hallucinations that the baby would be better off dead, essentially. There are some things that you can do if you experience this, or some things that you can recommend for other people if they have this. Any of these disorders, main one being, everyone knows that exercise. It releases endorphins in your body, and it can make you feel empowered. Meditation is a good way to connect with your breath and your body, and to just kind of center yourself and to think about what really matters. These are all good ways to kind of refresh your mind. Yoga was my favorite because it combined meditation and exercise together. And even if I just laid on the mat, I always felt better afterwards. Now, another important thing is reaching out to a loved one. Even if it's just a vent or talk to another human being, adult human being. It's very important to have someone that you trust, and that you can just talk to, because oftentimes they will notice if something's wrong and they will reach out to help you. Especially now with COVID, that physical support system isn't always there. So it's important to have people in your corner who you can call up any time of day or night to talk to. Now, the most important thing that you should do is contact your doctor. Let them know how you're feeling. The American College of Gynecology has a survey you can take online to see if you do have depression or anxiety. That's at safehealthcareforeverywoman.org. They are supposed to give you screenings at your postnatal appointments, which that helps a lot. And be completely honest when you're taking them. Don't feel ashamed. Every mom feels this way. There's no like wonder why moms feel this way. And if the yoga and the exercise and all that doesn't help, doctors often recommend psychotherapy, cognitive behavioral therapy, interpersonal psychotherapy, or antidepressants, which, like I said before, no mom should feel ashamed for taking these. Being a mom is hard. Being a parent is hard. And the best thing that you can do is to reach out to a new mom to ask her how she's doing. And it's not always about the baby. Ask the mom how she's doing. Let her know that you're there in case she needs anything. Let's change the stigma of having to enjoy every moment, because you don't have to enjoy every moment. It's hard, like I said. And it might be the happiest time of your life, but not every second's going to be the happiest time of your life. And however moms feel is okay. Now, if you are having feelings or thoughts of suicide or harming your baby, there is the SAMHSA hotline. Number for that is 1-800-662-HELP or 4357. Please call them if you have these thoughts, because the most important thing is for you to take care of yourself. And because in order for the baby to be happy and healthy, mommy needs to be happy and healthy as well. So thank you for listening to me today, and I hope you guys have a good weekend. Thank you.